You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. If you are missing one tooth, a few teeth, and especially if you have a loose-fitting denture, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Peter Wohrle. Dr. Wohrle, welcome to the program.
Thanks for having me, Randy.
Now, before we get into today's topic, tell us a little bit about your practice in Newport Beach. Do you mostly focus on dental implants?
We provide the entire range of services, but basically the main focus and all that I'm doing is dental implants.
Okay, what kind of patients are there? Mostly older patients, younger patients?
Well, we see, of course, the entire gamut from young people that either lost their teeth because of an accident to the middle age that kind of lose 3, 4, 5 teeth, all the way up to patients that, of course, had dentures and have no longer any teeth.
Okay, now your background in training, I guess you have 2 specialty trainings, prosthodontics and oral surgery. Tell me about that.
I did my dental training at Harvard University, and at that time...
So Harvard has a dental school?
Certainly does. The oldest dental school in the country, by the way.
Okay.
And that time I was in the right place at the right time. They opened up the first department of implant dentistry at Harvard, and I was their first student. So I did the first postdoctoral specialty program at Harvard in implant dentistry, in addition to my specialty program in prosthodontics.
Yeah, what is prosthodontics?
Prosthodontics is a specialty that deals with the maintenance and the replacements of teeth.
So now at your center, I guess you're a little bit different in that you do the surgery, you also put the tooth cap on, and normally that's done by 2 different dentists.
Yeah, typically that's done by a multiplicity of different providers, where maybe general dentist diagnoses and then oral surgeon or a periodontist inserts an implant, and then either the general dentist or the prosthodontist restores the implant. Since I'm trained in all the areas, I have somewhat an unfair advantage in that we still do the team approach, but it's just a team of 1.
Is that better for the patient, though?
Of course. How many people would you like to have working on your house? If it's just 1 person, if there's a problem, or even with issues with the price, if there's only 1 person, you get a much better outcome most often of the time.
Okay, what's changed, by the way, over the last 20 years? We've talked, you say it's much better.
Oh,
implants
in implants,
Why?
yeah. The procedures are much easier on the patients now. A lot of procedures were developed to load implants earlier, faster, have less invasive surgery, better diagnostic tools. The first surgeries I've done 20 years ago.
20 years ago?
Were massive, and the patients had massive swelling, and today we can...
Was it a lot of cutting back then? Now it's less cutting?
Yeah, we had to open up big flaps, we had to gain access just to take impressions of bone, whereas today, with computer-generated surgical templates and CAD/CAM, we can do very small incisions, deliver the implants, and the bridge is much faster, much more predictable, and much better looking.
Now, in your center, you even have a CT scan.
Yes, we have a
right?
CT scanner, cone beam, low radiation CT scanner. We use it every day just because we need to have a 3-dimensional volume of the bone.
Another thing, you say you can do the surgery before you do the surgery. Elaborate on that. What does that mean?
Yeah, we basically, when the patient comes in, we make some diagnostic scan so that we have a virtual reality model, a 3-dimensional model of the jaw structure of the patient, and we actually place on the computer the implants so that by the time the patient comes back for surgery, the location of the implant is predetermined.
Okay, and some people get their teeth in 1 day.
Right. That, of course, then if you predetermine the location of the implant, that allows you to make the teeth ahead of time, and if the implants are then inserted at exactly that location, we already have the prefabricated teeth, and that can get delivered at the conclusion of the surgery.
Okay.
And this, of course, can be done now much faster than the surgery we did even 5 years ago.
So the downtime has been reduced?
For the patient?
Yes.
Oh, of course. It's with these full arch procedures that are standard, there's basically no downtime.
What about pain? It seems very painful to get a dental implant.
That's the #1 fear of patients is of course pain. I'm happy to tell you that there's no pain fibers in the bone, so whatever we do and you could
Good point,
feel
okay.
is it related to soft tissue, and since we make such small incisions within the soft tissue, there's very minimal pain.
Okay, what about bone grafts, things like that? I mean, is that a thing of the past? I mean, from the hip?
In general, we still do it in accident victims or
It's very
special
rare.
cases, but for the vast majority of patients, bone grafts are per se, because with today's technology where we can actually find the bone on computer scans and use it, then we can restore patients without graft.
You say denture wearers benefit the most.
Of course, I mean,
How so?
who would like to wear dentures?
No, I guess not.
Nobody likes to wear dentures. The gums weren't designed to have dentures on top of them. Nobody likes to put that glue in the dentures to stick them in so that they're not embarrassed that they fall out. And fortunately, today we have the technology to eliminate those dentures very predictably, very fast, and much more cost
So they
efficient.
can get something fixed in their mouth?
Yes, yes, and that's all we do. We actually haven't done an overdenture where a denture secured 2 implants in the past 5.
It's like snap in,
That's
snap
right.
out.
Past 5 years. Everything we do is fixed reconstructions.
Okay, but you will do those snap in, snap out.
I haven't found a patient that
Wants to do it.
that wants to do it. It's typically because of inadequate bone volume, but today's technology, we can overcome that. Even in the long-term cost issue, it's comparable to what's called an all-on-4, where we have a fixed bridge, but much less maintenance. As you
So
imagine,
all on 4, you mentioned. That's what's hot. That's what's new in the world of dental implants. What does that mean?
where an all-on-4 basically means that we place 4 implants per jaw.
For a denture wearer.
Or people that are about to lose all their teeth. For
Okay.
somebody that has no teeth, whether they just lost them or whether they had them for 20 or 30 years, the dentures. And then we just go ahead and then place 4 implants in strategic locations, and those 4 implants are distributed such a way that it can support a fixed bridge. That is
Something that just stays
permanently
there.
attaches to the implant.
How does it feel? I mean, does it feel like they get their teeth back?
Yeah, it's the next best thing to teeth. It certainly doesn't feel exactly like your teeth because of the proprioception, but it's very, very close. And of course, if you have worn dentures for many years, it's a heavenly gift.
Now, on the right candidate, how soon can somebody eat? Okay, so denture wearer, they go in, they get this all-on-4 procedure. How soon can they eat?
Immediately after the bridge is attached to it.
That day?
The very day.
Okay.
The implants are very stable. They're connected together with a bridge. And with today's surface technology on the implants and good placement techniques, the implants are
But it
stable.
always wasn't that way, is that right? I mean, we've been doing the show now for 10 years.
That's right. I mean,
and I used to hear 6 months and 8 months.
That's right. That had to do with implant surfaces that were not as advanced as today's implant surfaces. So the bone turnover along the implant
So the
surface.
bone, what, grabs onto the implant better now?
Much faster, at a much higher rate. Plus, we have better techniques of placing the implants more stable.
Okay.
And that then allows, in most cases, what we call immediate loading. Now, there are some cases where we cannot do it if we have no bone or grafted bone.
Yeah.
In those cases, we still have a healing phase, or if we have soft tissue problems. But the vast majority of cases, especially denture wearers, we can do what's called immediate loading.
What about age ranges? You know, anticipating this interview, I knew I was going to interview today. Talked to my mother. She's 73, good health. She says, and she's wearing dentures since she was 28. She said her medical doctor said she's too old. They'll fall out.
Too old?
Yeah, 73. And that's opposite of what you told me.
That's right. With 73, I mean, if a woman today with 73 probably has another life expectancy of 20 years. And between you and me, that's a long way to go in dentures.
So but why would a medical doctor say that they'll fall out if that's not true? They just don't know?
No.
So that's just not true?
It's not true. Implants are placed in the bone. The bone in the skull is the last bone if the body needs calcium, whatever gets resorbed. It's the last place in the body where it gets resorbed. So the skull is the perfect place to do the implants.
What about sedation, things like that? Because I guess people are still afraid of going to the dentist.
It will depend on the patient. An all-on-4 and an all-on-6 is a routine procedure. It takes us less than an hour. There's very small incisions.
I mean, for everything less than an hour, I mean, somebody goes in, they have no teeth.
No teeth.
Denture wear.
That's right.
They walk out, they have something fixed in their mouth.
Less than an hour.
Okay.
Yeah. So in these standard procedures, we just give local anesthesia if the patient doesn't have any underlying medical issues.
Okay.
If there are problems with the heart or blood pressure or any other medical problems, then we have the anesthesiologist.
What about osteoporosis? Can somebody still qualify for dental implants if they have some?
Of course, osteoporosis is primarily a disease of long bones, meaning the legs, hips, hollow bones,
So
big
not the
bones.
jaw.
The jaw typically actually gets denser the older you get. So if you resorb bone, as you lose bone, the remaining bone is much better quality than a bigger bone.
Okay. What are the misconceptions out there, by the way, about dental implants that you hear on consults by denture wearers?
Well, I mean,
I guess pain. They think it's really painful.
Pain is one thing. Then they cannot quite imagine on how after the face has fallen and how we're able to restore that. And of course, we not only replace.
What do you mean the face has fallen?
Well, as you get older and you lost your teeth, the bone continues to resorb. And of course, you know, the typical denture wearer,
yeah.
where the lower face height decreases, the chin is closer to the nose, and the lips fall in because there's no more support by the underlying structures. And of course, we not only replace the teeth, we also replace the alveolar process, the bone in these areas on the prosthesis.
Okay. Now, a typical patient, and by the way, what are the older patients? So what are the age ranges of, how old can a patient be, is what I'm trying to say.
A patient's got to just be healthy enough to undergo routine medical procedure.
So what's the oldest patient?
The oldest patient we have was 92, 93.
Why would a 92-year-old, though, want a dental implant?
Because they still, the remaining time is the only time they have left.
Okay.
And if they have a problem that interferes with their quality of life, why put up with it if medically it's possible to have a better life?
So 92-year-olds are getting dental implants?
Yeah.
Have you had older, 70's young today, but in their 80s, denture wearers that are coming in, getting dental implants?
Certainly, certainly. Or people are starting.
Can they eat things like, I hear stories, corn on the cob and steak and...
And of course. Then as soon as they have
that's
the
strong.
the dental implants are locked together with the prosthesis are as strong as the natural teeth. So there's no issue there.
What are the different categories of dental implant patients you see?
Well, Randy, there are basically 4 or 5 different categories. It's the typical young patient that has either 1 or 2 single teeth missing, either because they never had the teeth or because of trauma, skateboard.
Okay, but what's a big advantage over what traditional dentistry does with just 1 tooth?
Well, if you have, of course, if you have 1 tooth missing, there's only one other option that for most patients, because everybody likes to have a fixed restoration rather than something removable where you take it in and out. That would be a 3-unit bridge where you grind down adjacent teeth. So if the adjacent teeth are perfectly healthy, a dental implant is actually a much more conservative approach because we save tooth structure. So that of course would be one category. Then the next bigger category is the baby boomers. There are people in their 40s, 50s that have 3, 4 teeth missing. And of course, if they don't do something about it now, then they will overload the remaining dentition and the remaining teeth will go. So partially.
So people that have 3 and 4 teeth missing.
Right.
Okay. And they have something in there. How are they more likely to lose more teeth?
Well, if you have 3 or 4 teeth missing and you're still chewing, of course, then you put all the force on the remaining other teeth, which in the long effect will overload those teeth, and then pretty soon.
So are they headed for disaster, as they would say?
I wouldn't say it's disaster, but if you lost teeth on one side, chances are you will lose them on the other side as well, because the process.
So what do you say to those people? Because that's a big group of people.
Well, what do you
missing
say?
3 and 4 teeth.
It's better to fix the one side before the other side goes.
So just get a couple of dental implants.
Couple of dental implants, 3 or 4 teeth, depending on how big the gap is. Stop the process and get a stable chewing surface.
But isn't it hard to get those kind of people in because all of us, we wait till the last minute. We wait until something goes wrong.
We would love to have more of these types of patients because considering their overall health, it will make a big difference on the remaining teeth.
Okay.
But it's human nature to postpone it, and it's amazing how the human body can adapt to just chewing on one side. But sooner or later, we'll treat them both sides.
Okay, so the denture wearer, moving there.
Denture wearers, that's.
Now, what are their options, by the way?
The options, what people don't understand is the longer you wear denture, the worse the problem gets.
Why?
Because the underlying bone continues to resorb.
Okay.
And
so kind of what, melts away because there's no pressure?
Yeah, because it's similar like muscles. If you don't use your muscles, they kind of melt away. If you don't use your bone because you don't have any roots there anymore, it will melt away. And the way the body can tell if we have still teeth or not is, of course, with force transfer. So if there's no force transfer within the bone will melt away. and especially in the lower jaw, this can lead to what we call a dental cripple, where the floor of the mouth, where you have the tongue attached, is actually higher than the ridge. And the flatter the ridge, the bigger the problem.
Can somebody be too far gone to get dental implants?
No.
So there's always something you could do.
There's always something we can do. There's hardly any patient where we could not place implants.
Okay, I had a periodontist, and I respect periodontist, but our shows air nationwide. I get a lot of different information all the time, and what you're saying today is a little bit different than what I've heard, because they're saying, Randy, to give somebody something fixed for a denture wear in their mouth, 6 or 8 implants. You're saying 4.
Right. What we learned really is that in implant dentistry...
But this was a month ago that I hear that 6 or 8 implants. Are you saying that that's just not true?
It's a multifactorial problem. It first will depend on the load transfer. Probably you need, the way you think about it is you need more implants if you have a big guy, 300 pounds, big muscles like this compared to an elderly lady, right?
Okay.
It's because obviously the bigger the muscle, the bigger the forces.
But a statement that you just can't give somebody something fixed with 4 is just not true.
That is not true.
Okay.
We actually know from the scientific literature, if you had 3 implants that are integrated, that could work too if they're distributed in the right place.
And obviously it's a lot less expensive.
Randy, of course, what we've learned during the past 20 years is that in implant dentistry, less is often more.
Okay.
If we put too many implants in, too close together, we have problems because of the blood supply. And if you spread them out, and if today, with today's technology, where we actually can place the implants exactly where we need them, we can do with less implants. So you basically just put them at the corners of the arch, 2 in the back, 2 at the canine region, and we have a wonderful distribution. And then prosthetically restoring them, the higher the number of implants, the more complicated it gets, and again, the more costly it gets.
So less is more.
Certainly.
I've had doctors on that I've talked to about this topic, and they say, Randy, if there was a try-in period for denture wearers with 4 implants, they couldn't go back to their denture. Do you believe that too?
Oh, of course. If somebody had once removable appliances, dentures in the mouth, and then went to fix, they never want to go back.
Why? Well, then why isn't everybody doing it? If it's as good as you say it is, and the way you describe it,
well,
why aren't all the 20 million denture wearers running into?
Well, I mean, one of the problems is, of course, that denture wearers typically don't see the dental professionals anymore because
interesting. Okay, good point.
They have no more teeth to get fixed.
All right.
And once they're
so nobody's suggesting it to them.
So nobody suggests them. Nobody tells them what today's options are. Maybe they inquired once and the prices were rather high for treatment. Today, with these new approaches, we can do it much faster.
Low downtime. You say same day.
Same day. And we can do it faster, less expensive, more predictable.
Should they ask, and we're going to go to a break because we talked on the phone, that all-on-4. Should they say, hey, do you do this all-on-4 procedure for the denture wear?
I think
should they ask that of them?
I think it's certainly something they should discuss with their healthcare provider, because it's a revolutionary treatment concept, where in a lot of circumstances we can eliminate grafting and give patients a fixed dentition with high predictability.
All right, okay, and as far as what to look for in a dentist that's going to do this, and I'm trying not to be on your side. People need to know this is a real interview.
Sure.
You're not scripted. We haven't planned this out, but I mean, should they always look for somebody that this is their focus, this is what they do? And number 2, you have the CT. You both do the surgery, put the tooth cap on.
Well,
it's done all under one roof?
I think the most important part is experience of the operator, as with any other medical procedure.
Okay.
And have a clear understanding where they're going. Some of the problems we have with team approaches, where 2 or 3 providers kind of provide the care, is that they're not all on the same page. So
and that's how it's mostly being done nationwide?
And that's how it's mostly done. And this is why I think that's why the single provider model, where you either have everybody in the same clinic, or you have multiple specialty personnel like me do the entire treatment, because placing the implant and the teeth on top of it is one and the same thing. It just has a more surgical or a more restorative aspect.
And they don't complain about pain, because that seems like that would be a painful process. It's not something I mean, what do they go home with? Are they a Motrin or something?
Yeah, I mean, typically the patients go home with some pain medication. Not even narcotics, non-narcotics, that most of the time works very well for the type of procedure we're doing.
And they're eating that night.
And they're eating that night.
Okay, we're going to take a quick break. And when we come back, more about the process, what they can expect on day one. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Peter Wohrle, and we're talking about what you need to know if you're considering dental implants. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us, we have Dr. Peter Wohrle. Okay, now what about people that they go to their dentist or general dentist and they say, okay, your teeth have to go, I guess for whatever reason. Dentures, dental implants.
Well, I mean, typically patients that are about to lose their teeth, most of their teeth or their remaining teeth, suffer most often of periodontal disease, meaning the bone around the remaining roots is disappearing.
Okay.
And
they have bad gums.
No, they have bad bone.
Bad bone? Oh, it's a bad bone.
It's a bone problem rather than
All
a
right.
gum, but it's perceived by the public as.
Because I talked to somebody, they said, my gums are too bad. I probably couldn't get dental implants. Is that a misconception?
It is a misconception. Of course, if we wouldn't have periodontal disease, we wouldn't need the implants because that is the reason why people lose the teeth in the first place.
Okay.
So the vast majority of implants are done, of course, in patients that have periodontal disease because that's how they lost the teeth in the first place. Depending on how many teeth you're going to lose, sometimes if you keep teeth too long in one area, you're going to lose bone around the roots of the teeth, and you cannot do an implant right at that location.
You say people keep their teeth too long, and
Yeah,
they go around without smiling.
Of course, I mean they have bad breath, they develop spaces, the teeth shift because they lack the support, and then socially patients don't interact anymore. They stay home.
Is it their fear of the dentist? Is that usually what it is? I mean,
I think it is fear of the dentist combined with not knowing what else to do. They kind of give up. And of course, with today's technology, I mean, even if the teeth are hopeless, they're not useless. We use these periodontally involved teeth to hold up temporary restorations till everything else is cleaned up, and then we place implants, and then ultimately we transition the patients then from a hopeless periodontal disease dentition to dental implants. So there are a lot of different ways we can do it, but we can help those patients.
Now, people travel great distances to see you.
We have patients coming from all over the world, yes.
Is that right? How do they hear about you all over the world? Is it from your website?
Well, it's mostly word of mouth, and fortunately I'm involved in a lot of lecturing overseas.
That's right, you train other doctors.
That's right.
I should have mentioned that. You teach other doctors the dental implant process.
Different types of procedures, and then I'll get referrals from either those doctors or most often those doctors themselves. If they need an implant, they come in.
Okay, now you don't look like a dentist. I told you that at the break.
Is that a compliment?
Yeah, it is. No, well, I don't know if it's a compliment. No, you look too stylish, I think, to be a dentist.
Oh, I see.
When did you know you wanted to be a dentist?
That's an interesting story. My father was a dentist.
Okay.
And I never wanted to be like him.
All right.
So of course, I never wanted to be a dentist. I actually went to business school first after I graduated. But sooner or later, I realized that dentistry is really what I wanted to do.
And you like it. I mean, you love it.
I love it. I breathe it. I mean, that's all I do. I implant dentistry. Since I went through my training program, I don't do anything else. And
okay.
I remember the words my dad told me is, the more often you do something, the luckier you get at it. So.
Okay. I mean, you've done hundreds and hundreds of...
Thousands and thousands. I mean, that's all I've been doing for the last 20 years is dental implants.
Is there a big learning curve? I mean, to somebody watching this, you know, they're considering doing this.
Of course,
how important is experience?
Experience, I think, is very important. There are cases that are simple where experience won't make that big a difference. But the biggest problem, of course, is diagnosis and treatment planning. And if the diagnosis is off, the outcome cannot be good. So I think the number one thing you got to look for in a provider is experience and knowledge of the operator.
The process, and we are just about out of time. But if somebody goes in, how soon before they find out they can do it, that they're candidates for dental implants?
As soon as patients come in the office, we'll do a visual examination. We'll see if they even need an implant. A lot of patients come in for an implant and they don't need an implant because they need a root canal or something else.
Okay.
But if patients have missing teeth or are going to lose their teeth, of course the first step is to take an x-ray, a cone beam CT scan, right then and there, and we'll look at it, and they know right then and there if they're a candidate.
And the CT's in your office?
In the office.
How come you're not sending them across town like everybody else? I'm kidding around, by the way. That's because you have your own CT. Okay.
Because it's much more convenient, and we need the answer now. So if a patient comes in to find out if they're a candidate, they know within 20 minutes if they're a candidate, and they also know the price of the treatment and their options. So our office is geared towards providing that service.
You meet with them all one-on-one?
All one-on-one, yes. We'll go through the radiographs, we go through the analysis of the casts, and we look at the different treatment options. For every patient, there's different options, and depending what the patient's looking for, we can then pursue one or the other.
So your recommendation, somebody watching this, I guess they're missing a tooth or they're missing all their teeth, they're in dentures 20, 30 years, what's your message to them? They're afraid, they're skeptical.
Well, the message is, of course, get checked out, get evaluated, and I'm sure with today's technology, we can get you out of your denture and back to a better life.
With something fixed.
With something fixed.
All right. Well, I want to thank you so much for coming on the show. Very good. Very interesting.
Thank you so much, Randy, for having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct it to a friend, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.